All right, welcome. Welcome to another Facebook Live. My name is Dr. Sam Sunshine, and I am super excited. I have a great guest that I've been wanting to get on my Facebook Live for, gosh, at least a month now. And her name is Dr. Ann Zuzelski, and we do practice some similar medicine. And I wanted, first of all, thank you for coming. I'm super excited, as you know, to have you here. So I wanted you to give our audience maybe a little background about your medical education.
Sure. And thank you for having me. This is fun to be here chatting with you. So, I am a physical medicine and rehab specialist. I was trained back in Michigan, which is where I'm from. So, I did my undergraduate, my graduate training there, and my residency. And that's a specialty that's kind of part of it is focused on kind of being more athletic and trying to get people back into their sport or whatever activity they want to do. So that kind of excited me about that part of it. So I actually eventually went up and got some more training in spinal cord injury, which is kind of a complete opposite area of rehab. I was practicing that for a while, and then I got a little more interested in I was introduced to prolotherapy from one of the doctors in our area, and he showed me that I could help these spinal cord patients that had a lot of pain that I wasn't able to do a whole lot with them. So that's kind of how I got interested in what I do now. But I was traditionally a spinal cord and rehab doctor.
Okay. I didn't
Yeah,
actually know that about you. So that's
yeah.
exciting. So really the topic today is going to be prolotherapy. And that's something, again, that both Dr. Zuzelski and I have done. When did you start doing prolotherapy on patients?
Yeah, so that when I met that doctor back in Grand Rapids, that was in 2013, I want to say 13 or 14. And so then I went to get some more training. I went to a conference and started practicing and kind of gradually started getting more confidence with the procedure. And I did some more training with this group that I worked with, Hackett Hemwell Patterson Foundation. They run a conference every year. It's actually coming up in October. Um, and then they do a mission trip where they go down to Honduras and Mexico. And so you first go for 2 weeks to Honduras and you're able to treat tons and tons of people there. And then every year after that, I had been going to Mexico to do some more training and mission trips with them every week.
Yeah, so one of the things I'm envious that you've done in your training that I haven't is going on these mission trips, which I think are fascinating. And
Yep.
I know when I've seen video that a lot of these patients are waiting, and you have an entire waiting room full of patients, and they're so excited to be treated. Most of it, these are third world countries, and they just love that the doctors are coming down and helping them. Um, we met, I think it was in 2014 in New Orleans at a prolotherapy conference.
Mm-hmm.
And at that time, I think you were still living in Michigan and you were thinking about coming out west, and here you are. And one of the things that differs from us is that I tend to do more joints, shoulders, elbows, knees, as you do too. But because you have the expertise in spine, I refer a lot of my patients to you who have neck pain and lower back pain, and they've had great results. What have you seen in, and again, we'll come back in just a second to talk about what prolotherapy is, because that's really the keystone of this talk. But what has been your experience in treating necks and backs in terms of the types of patients you treat, who do you see who come to you specifically for prolo of the neck and back, and then what have been your outcomes, what your success rate?
Yeah. I think, and I think your experience with prolotherapy is similar to a lot of people that start to learn it because as a rehab doctor, we are trained a little bit more strongly in the spine, necks, low backs. So we have sort of a baseline understanding, which is why I think I'm a little bit more comfortable treating them. But yeah, it's one of our strongest areas for prolotherapy because I don't think there's a lot of treatment options for people who don't want to do surgery. So, we see somebody who's a new patient and have already or are about to start maybe physical therapy because that's one of the number one treatments that we do. And then maybe they've tried some oral and topical medications, maybe they've considered surgery or already done surgery by the time they get to me. And so they kind of feel like they're out of options. So I see patients all the way from maybe teenagers all the way to 90-year-olds that come in with spine pain. And um, it's hard because it's a very progressive disorder where, maybe when we're younger and we're a little more active in sports and just life in general, specifically women who give birth, the pregnancy hormones will relax our ligaments of our spine and cause a lot of problems. So, I think people develop pain and then they feel like they have to just live with it and it's just a fact of life. But when they start receiving treatment, then, pretty quickly, sometimes even after the first treatment, they'll notice a benefit. And so they'll say, oh my gosh, I can't believe I feel even a little bit better. I mean, usually people don't get completely better just after one treatment, but it's eye-opening because again, these people just thought they had to live with this pain. And it's really it's enlightening for me to see that,
Gratifying.
totally gratifying because there's something we can do that doesn't require surgery or being on meds for the rest of your life. And, it's just a really nice kind of natural option to help these people.
Okay. So that's great. So really what you've said is you treat all ages, male,
Yeah.
female, and it's really improving, reducing pain, improving function. So when you say they're feeling better, it's really they were able to do things that maybe they weren't able to do, and then they're able to sleep through the night because not waking up by pain or feeling pain during the day, or say, no, I can't go golfing or I can't go on a walk because my back bothers me or my neck bothers me. And you're able to really help these people where really they've exhausted all the other options. Again, prolotherapy, at least for me, I'm not taking somebody who injured themselves in a football game and then giving them prolotherapy on a Monday if they had a weekend injury. It's usually people who start off on physical therapy or different modalities or just rest. And generally when they come to us, it's usually after they've said, you know what, none of this is really, it's getting me to a point, but it's not getting me better.
Yeah.
And that's where I think prolotherapy comes in. So again, we haven't really talked about what prolotherapy is. So that's going to be our next thing. So tell us kind of what is prolotherapy for our audience?
Yeah, so prolotherapy, the name kind of comes from the word for proliferant therapy. And the idea is that we're able to proliferate the body's own tissues and help to repair joints, cartilage, muscle, tendons, whatever it is that we're treating. So what happens is we use the body's natural healing system and we just enhance it. So I tell this to patients all the time. Think about an injury that you have. Let's say you slice your finger and it starts to bleed and it gets sore and it gets swollen. That's all inflammation going to the area. And then over time, the body starts to repair itself. So it calls in stem cells from other parts of your body, and eventually, over the following weeks to months, that wound will heal. So what we're doing with prolotherapy is we're kind of recreating that scenario. So when you injure yourself, maybe it's a sports injury, maybe it's just walking or picking something up, the body will go through that natural process. And a lot of times it will do it completely and you'll be fine and you'll heal. But sometimes the injury was too big, or maybe your body doesn't have enough of the right tools like nutrients or stem cells to heal it. And so it gets kind of caught up in this phase where it can't heal fully and it's just painful and not functioning properly. So with prolotherapy, we can go back into those areas and we can inject a solution that actually causes a little bit of inflammation. And so it just restarts the natural healing process. And so there's a lot of things you can use. I use a sugar solution because that's one of the most common things that we can get available to us. So the sugar at a right concentration actually causes that inflammation. So again, it's a pretty natural process and we're just helping the body heal on its own.
Okay. Again, triggering our own immune system to come and heal an area that hasn't fully healed and that you have persistent pain. And you mentioned concentrating the sugar to a certain amount, too little, doesn't trigger the immune system too much can be toxic to the soft tissue. So it's got to be specific concentration, depending if you're giving it to a joint versus a tendon or ligament. We won't get into the details of that. But the thing that's always interested me is, one, I have a great success rate. I kind of quote 80% of the time I can get people better. What's been your experience with, primarily, I know you do the whole body, but specifically with your neck pain patients, your low back pain patients, what's of the people that come to see you, what percent get better and stay better?
Yeah, I mean, everybody wants to know that number, and it's kind of an easy number to give because I've had a similar experience. Most of my patients feel some level of relief. So the question is, can we get them fully out of pain? And how many treatments will that take? We don't know. We don't have a crystal ball for that, but I tell people for any given body area that we're treating in the whole body, for any given person I'm treating, because that's a variable too, it can take between 4 and 6 treatments before you don't need any more. And of course, there's people that go on to get more than that. There's people that will come in for more of a maintenance treatment after they've healed. And some people are really strong healers and they might take fewer treatments than that. But even after just the very first treatment, I would say most people feel some level of relief of pain.
Okay, that's great.
Yeah.
And we'll talk a little bit about the healing cascade too. If we have anybody who's watching live, if you wouldn't mind typing in maybe your name and where you're from into the comment box, that would be great. If you do have any questions, we're going to probably save questions in about 10 minutes. We're going to continue our discussion on prolotherapy. Again, Dr. Zuzelski, we're in Orange County, Southern California. And at the end, I'm going to have Dr. Zuzelski give you her information if you wanted to contact her, if you've got a neck or back issue that hasn't been remedied with standard therapy. And again, it's not to say that standard therapy doesn't work. It works most of the time. Again, rest and proper treatment, self-treatment, oftentimes is all you need when you have an injury. But again, there are still a huge percentage of people who get injured that don't fully heal. And these injection therapies kind of nudge our body to finish the job and complete the healing process. And as a result, improve range of motion, improve functionality, and reduce pain is what we see. Why is it that you and I get really good results, we can help people, but yet nobody knows about prolotherapy? Again, when I talk to therapists, they've never heard of it. When I talk to doctors, they've never heard it. Why is that?
Yeah, that's a really good question. It's been around for probably close to 100 years at this point. Started in, I think it was the 1930s in the Chicago area, and a doctor there started treating patients and getting really good results. And it sort of, there were certain people that worked with him, and it was a very small field of prolotherapists at that time point. But over the years, more and more people have gotten trained and practiced this. But I think the biggest reason is that it's not covered by medical insurance. So that limits what a lot of people can get in terms of treatment, but it also limits the number of doctors that actually go to get trained in it. So it's not something that we're taught in medical school at all. I had to go and get extra training, and you too, after school. So that's one thing. It's not even discussed in our training. And then, past that, I think that a lot of doctors have trouble understanding how it works and why it works. I mean, it's such a simple solution to these crazy problems that, require surgery and therapy and all these other things that we've been doing for so many years. So it's kind of hard to believe that a little sugar solution can totally take away somebody's pain. So those are, I think, the biggest factors of why people don't know about it. But I would say when patients and doctors start learning about it and practicing it, they understand why it works and they want to keep doing it because it's effective.
Yeah. So there's been a couple people, I've been doing this now for about 15 years, and I've always talked to you about like imposter syndrome, because nobody does this, am I doing the right thing?
Right.
And you're like, well, are people getting better? I'm like, yeah. And I'm like, well, keep doing it.
Right.
So I do promote it to some degree. Currently, I'm building a membership practice, as you may know, but patients can come see me outside the membership and be treated. You mentioned insurance doesn't cover it. It's a cash practice.
Mm-hmm.
And I think what some people feel that if insurance doesn't cover it, then therefore it doesn't work.
Yeah, I think that's the wrong way to think about it. And actually, prolotherapy is so great for a practice like yours because it's really, yes, it can heal pain and injuries after they occur, but it's also more of a preventative thing. I mean, we'd like to start treating people before they get to the surgical point, or, when their injury is much newer, not like the athlete, like you said, that got injured 2 days ago, but maybe in a month or two, if that pain is still around, then we aggressively treat it then when it's easier to fix and we're not having to do the 6 treatments for that person. So it fits really nicely into your model too. And, I hope that more people can learn about it and experience it that way because that's the best situation for it.
Yeah. And I'll tell you for the audience, the main reason that I wanted Dr. Zuzelski to come on is to educate the audience, you guys, about what prolotherapy is, and that if it's something that you're dealing with, like a chronic injury, like knee pain, or a joint that feels unstable,
yes,
or neck pain, low back pain. Again, I kind of shy away from necks. I'm not trained in necks, so I refer to Dr. Zuzelski, and she's very close to my practice in terms of location. And then low backs, I do some. I'll inject some of the iliolumbar ligaments, and I'll do the SI joints, and I'll do some hamstrings. But really, I've seen you treat backs. You've treated my back a few times, and maybe this is a good, just a side story. But I remember one time I had pulled my back. I can't remember what I did. I think I was surfing, and just standing up, and I felt my back tighten up, and came crawling to your office on a Saturday. I made it up she's on the second story of this was her old practice in San Juan. And I got up there, and I think I was just leaning over the table, and you gave me some injections. This was actually a perineural treatment, which is more of a dilute concentration of glucose into the pain points. And then literally after about 10 minutes, I think you gave me a series of injections, I walked out of there 80% better, and then the pain gradually subsided over the course of 3 to 5 days. And I just marvel at this. So I've been a patient of prolotherapy for 14 years. I was my first patient. I don't know if I ever told you that, but I had tennis elbow that wouldn't go away for 9 months. I probably got it, I think, from lifting weights, doing pull-ups, and I was doing sport physicals for Concordia, a university nearby, and I knew an orthopedic surgeon was going to be there, and so I drew up the solution. I said, here it is, give it right here.
Yeah.
And within probably about 6 weeks later, it was gone. Yeah. And that was 15 years ago, and it hasn't come back. It hasn't been my weak link. So let's talk a little bit about, spend maybe a minute or two talking about how our body heals and what's an expectation of a patient if they come in and see you to say, well, gosh, if I get this injection, when am I going to start feeling better? Because that's what everyone
wants to know.
You get the email back and say, hey, it's been 3 days, I don't feel any better.
Yeah.
And so maybe you could talk a little bit about that, like how long they would expect to feel pain, because it's an injection. You like to use small needles. I tend to use a little bit bigger needles. But and I think that does matter. But again, the needles are small. There is numbing medicine in the solution. So when people leave the office, they feel great. Yes. And that gives an indication we went to the right spot because the pain's gone. But maybe you can talk about that healing cascade a little bit.
Yeah, so all of these injections that are meant to heal the body naturally, like I was talking about earlier, how they're simulating the inflammation, they do cause some additional pain. So usually it's between 3 and 5 days after the injection. And you're right, there's anesthetic in it. Usually that lasts about 3 to 4 hours. So they might walk out of your office feeling great. And then I always tell them the pain's going to come. It might be, more achy and sore. It's usually not horrible, but I have had a few patients that have had increased pain for even a couple weeks after. But usually it's that 3 to 5 day period. And then it kind of goes back to their normal baseline level. And then it can stay there for maybe 1 to 2 months. They might not feel any benefit until that second month after the treatment. But some people, especially people that have a stronger component of nerve pain along with it, they'll actually feel better right away. And that pain relief might last for a while, even a few weeks. And then they might kind of go back to their baseline. And then usually we do the injections once a month because we know that usually it takes more than one. And I tell patients to use that as their pain as their guide. So if you're still having pain at 1 month, then we'll do another injection. So if you're completely out of pain at 1 month, I wouldn't say we need another injection at that point. And then we're treating once a month, and then each and every injection you get a little bit better, and eventually you don't need it anymore.
Yeah, it's generally what I found too. I've had some cases where people get one injection, they say, it didn't work, I'm going to have surgery. That's fine if that's ultimately the path you want to take. But I too will find that with persistent care of that patient, that area gets fixed. Do you also use physical therapy?
Yeah, I do.
In your patients?
Yeah.
And why?
Yeah. And back on your point, yes, I tell people don't get super angry if you don't feel anything after one. Give it 2 or even 3 tries before you call it quits. And usually by that time, people have started feeling something, so they're happy to continue. And then there's the patients, like you said, that just have instability. I've definitely treated them before. I mean, there's not a lot of people that come in and want to get injected if they don't have pain, but you do have some athletes specifically that just kind of feel like a joint is loose. And so for them, you can't really use pain as their guide in terms of continuing treatment, but they notice the instability improve right away within the first month usually.
Great.
But yeah, along with that, I would say most of the time I want my patients to do physical therapy. A lot of times they've already done physical therapy, but it's always helpful to do along with the treatments that you're doing because your body's changing, and the exercises that you are supposed to be doing should, sometimes they're changing too. So it's nice to work with a therapist that knows what they're doing and can guide you along that, because the muscular stability of those joints in the spine is super important, because as you're healing, you're in pain and the joints are unstable. So we want to make sure that we provide the best environment to heal those joints. So to do that, you need the support of the muscles, and that's where the physical therapy comes in. And also the alignment of the spine and the joint itself. Sometimes you need a little adjusting, and they're really good at that. So,
yeah. And they can give the patients the extra time, and again, looking at alignment, looking at strength, finding what the weakness is, where to work on. We don't have necessarily the time to do all that stuff. And so using therapists, chiropractors, working with acupuncturists. We also do compression wear. There's a company we use. We won't get into the details of that, nor will we get into like the area of nutrition. Both of you and I are big on nutrition, that if you're not eating the right things, no matter what you try, probably won't heal you. So you've got to be using food as a healing agent.
Yep.
And sleep and proper exercise. All that is super important. Yeah. So kind of just to summarize, and there's another topic I want to bring up. We've talked about prolotherapy. It's an injection therapy that is used to help heal structures in our body, like soft tissues or joints. You do everything, all ages, male, female, necks, as well as what we call the appendicular skeleton. That's the joints that aren't the spine. I just do the outer structures. I don't do the spine except on low back on small areas. And if you want to learn more about Dr. Zuzelski and how to get a hold of her, she's going to give you that information now. So if you have a pen, write that down. And if you have any comments or questions, now is a good time to ask. And then we can address those questions. So why don't you go ahead and tell our viewing audience how they can get a hold of you?
Yeah, so I work at a couple different locations in Orange County. I work through the University of California at Irvine at a clinic. It's actually an integrative holistic clinic through the university that is called the Susan Samueli Institute, Integrative Health Institute. So they can find me there. I'm there a couple days a week. And then I work at another private practice office in Irvine called the Institute for Progressive Medicine. And so they can also find me there.
Okay. So just to go through that again, Susan Samueli, UCI. And are you in a particular department, or that's just, it's a pretty small clinic that everyone knows everybody?
It's the Susan Samueli department, I guess. I mean,
Okay.
it's just like a whole separate outpatient clinic of the university.
And then the other one is the Institute of Progressive Medicine, or the Center for Progressive Medicine.
Institute
for Progressive Medicine. Again, UCI is in Irvine, as well as the Institute of Progressive Medicine is in Irvine, right?
Well, actually, the UCI clinic is in Costa Mesa and Newport. We have a new office that opened at Fashion Island.
Are you there too?
Yeah.
Oh, great. Wow.
Yeah.
Wow, Newport Beach. Wow. Hoity-toity. All right. So here's a question. How is, and I'll pose this to you, how is prolotherapy different from platelet-rich plasma or PRP? I'm oftentimes surprised most doctors some have heard of platelet-rich plasma, but a lot still don't even know what platelet-rich plasma is. Yeah. Certainly very few people have ever heard of prolotherapy, which you and I kind of scratch our heads. But what's the difference between those two treatments? Yeah,
so the treatment that a patient receives is actually very similar. The injections are in the same spots. The only difference is we're injecting a different solution.
Okay.
So I take people back to that scenario of, you slice your finger, the whole inflammation, the blood flows to the area. With that blood, it brings platelets. Those platelets are full of growth factors. All different types of growth factors are super important for healing. So what we can do, instead of just stimulating inflammation, we can actually give the body a super concentrated number of those platelets. So what we do is we do a blood draw, we spin it down in a special machine, we remove the red blood cells that aren't important for healing, and then we just give the patient back platelets, and a larger number of platelets than they would normally get in a normal injury. So you're sort of skipping over that first inflammation step and you're going straight to the platelets. It's a stronger therapy than prolotherapy, and it is a little bit more uncomfortable to get because it's a blood product and we can't use as much anesthetic with it.
Okay.
So because it's stronger, though, it works better and you require a less number of injections. So maybe instead of 4 to 6 prolotherapy treatments, you're looking at 2 to 3 of the PRP.
Okay. So a little bit of information about PRP, or platelet-rich plasma, as well as prolotherapy. Again, you do that, and you've been doing PRP injections probably just as long as your prolotherapy, and you've been doing it for years.
Yeah.
Yeah, me too. And I remember a time when PRP was covered there was a short window when I was administering it, so it was great to give it to patients, and they didn't have to pay for it. Now it's no longer covered by insurance. What's your experience? Do you find that some insurances are covering PRP now?
I've had a few patients be able to submit it to insurance and get some reimbursement. I think sometimes the workers' compensation injuries, and if you've been in an auto accident or something like that, then we can get it covered. But usually commercial insurances are not covering either of these, and they consider it experimental. They say there's not enough evidence out there, which, there's a lot of research that continues to be done and has shown that these, treatments can be helpful. But they just, I think the insurances are, they just don't consider it that helpful
yet. It's really
yet.
unfortunate.
It's unfortunate because it actually would save them a lot of money, keeping patients out of surgery and other more expensive treatments. But
yeah, and that's a topic for another day, looking at the price we pay and what drives medical expenses. It's shocking. There is a great book by this guy, Marty McCary. It's called The Price We Pay. If you ever want to learn about how healthcare is kind of the game of healthcare is run in this country, that's a great read, and you'll get a better understanding as to why certain things that are really beneficial, like PRP and prolotherapy, aren't covered and probably never will be. And then things like joint replacements that are just escalating in cost are kind of the go-to thing for joint pain. So we're kind of getting close to the end of our half hour today with Dr. Zuzelski talking about prolotherapy. If you have any questions, any other questions, would be a great time to ask. Again, she's at the Susan Samueli Center and she's at the Institute of Progressive Medicine. And those are both great clinics, and you can get a hold of her there. I definitely want to thank you for coming out. I know this is like not your top 10 list of things to do, but for me, I want to educate people. This is something that I've always loved to give to people is prolotherapy treatments and PRP treatments, and patients do great. And it just, I wanted to educate the audience more about prolotherapy. So maybe we'll have you back in a few months and we can talk a little bit more on maybe a topic or variation of what we talked about today. Maybe take it a little bit of a deeper dive in prolotherapy on the spine, maybe showing an injection maybe, or using a dummy.
We should inject you.
And we can, yeah, which would be fine. I'm not afraid. I want to thank you guys for tuning in and asking your questions. And we're going to be trying to do a Facebook Live here at OC Sports and Wellness on Thursdays from 12 to 12:30. And that may or may not change depending on who we can get to come to speak and their availability. I wanted to thank you again. I want to thank you, Dr. Zuzelski. Really an honor to have you. Again, she's one of the best prolotherapy PRP administrators, really west of the Mississippi. And I know she'll. I don't want to embarrass her, but when I ask the experts, who can I get trained by, and I'm in California, they'll be like, oh yeah, Dr. Zuzelski, she's the best. So really, you can't be in better hands than her. And I mean that with all sincerity. So thank you again for listening. Appreciate you tuning in, and we'll see you again soon.